Hi, I'm Dr. Kelly Killeen. I'm a double board certified plastic surgeon in Beverly Hills. So I've been getting a lot of questions from my social media, and I just wanted to do a little longer form video and answer them for you guys. All right, so I'm going to be reading questions that people have been sending me. So first of all, a lot of people have asked me where am I from and how did I get into surgery. So I grew up in Southern California in a town called Redlands, which is about an hour east of Los Angeles, about halfway between LA and Palm Springs, if you know the area, and it's the 909. So we were kind of the area everybody made fun of that actually lives in LA. I am a child of two surgeons. And I think it's in my blood, obviously, to be a surgeon. And I went to medical school in Loma Linda, which is right next to Redlands. So I am a SoCal girl through and through. Okay, next question is, are you married? And tell me about your dogs. So I am married. I've been married for 11 years. My husband's name is Clayton. We have two kids. They are 9 and 10 and a half, Cece and Grayson. I have 4 pets currently. I have 2 ragdoll cats. The best cats ever. You'll see them on my social media. I post them all the time. And I have 2 show dogs that actively compete. They're both Dalmatians. I have a liver spotted Dalmatian. So for those of you that aren't familiar, that's a Dalmatian with brown spots and not black spots. Her name is Rory, and she just finished her championship, which is really exciting. And then I have a black and white spotted Dalmatian as well, a puppy named Reese, and he just entered his first show and won one day last weekend. All right, next question is, what is your favorite movie of all time? So I have so many, and please don't judge me. I don't like meaty films that teach me something. I like things that are just entertaining and fun. I love rom-coms. I'm just that girl. I'm sorry in advance. So one of my favorite movies is Sliding Doors. It's this kind of, it's niche. It's like a British movie with Gwyneth Paltrow in it. And it's a rom-com, but the whole kind of shtick of the movie is what would happen if like there's a one moment change, like 2 different realities for how your life would be different. So I don't know, I think it's really interesting to think about that, how every little choice in life could have very different outcomes. So I don't know, I've always loved that movie. Okay, so next one is your favorite TV shows. So there's so many TV shows that I love. So I'll just tell you kind of what I'm currently watching right now. So I'm rewatching The Office. Love The Office. I think this is like the 3rd time I've gone through it. My husband and I watch it together. So number 1. And then also probably one of my recent favorites is Stranger Things.
You have got to understand that there are consequences to your actions.
You are like Papa!
I love Stranger Things. That's one of my favorite shows. This last summer's season was amazing, and I can't wait for the final season next year. All right, so let's get into some of the medical questions. In your residency, what was your favorite procedure to do? So this is not gonna sound like something from a plastic surgeon, but I would say one of my absolute favorite procedures, if not my favorite procedure, and I didn't do the specialty weirdly, is kidney transplant. Kidney transplant is such an amazing surgery. It's just incredible. It has every element of surgery I love. It has blood vessel surgery, which is amazing. There's something so impressive about plugging that kidney in and immediately it starts making urine. It's absolutely life-changing for patients. They go from dialysis several times a week to no dialysis. Absolutely incredible. My chief year of my general surgery residency, I think I did 54. Like, that's how much I love this surgery. I would actually seek them out. Okay, so next question. I get this all the time. For transparency, have you had any plastic surgery done? So I've talked about this already. So yes, I've had plastic surgery done. I've had a breast augmentation when I was 21. I had a revision about 10 years later, and then I had another revision this last year. My last revision, I had a little bit of fat grafting, and the donor site where they took the fat was my love handles. So I had a little liposuction of love handles, which was an awesome side effect of that surgery. All right, so next question, what is your morning routine like on operating days? So I have a lot to do at home, so I get up pretty early. So I usually get up about 5 o'clock and I make sure that all of my pets are fed and I help get my kids ready as best I can because it's early before school. Surgery starts at about 7:30, so I get to work at 6:45. I review my notes on my patient to make sure that I know exactly what I'm doing and there's been no changes since last time I saw the patient, which is usually about a week before their operation. And then I go in and mark my patient, talk to them, make sure they're comfortable, ready to go. I check in with the OR team, make sure that we have the room set up with everything I need for the surgery, and then we get started about 7:30. All right, so this question's great. So how was it coming up through the ranks as a woman in plastic surgery? So currently right now, about 18% of board certified plastic surgeons are women in the United States. So Even though we comprise about half of medical students right now, we're still slow at getting our foot in the surgical subspecialties, and plastic surgery is the same. So I was very lucky. The programs that I was in, both Cedars-Sinai for general surgery and OHSU, Oregon Health and Science for plastic surgery, were pretty female friendly. We had a good number of female attendings, and in Oregon I had a female chairman. So I think that my experience was probably a lot better than other people. That being said, there were the kinds of things that you hear about with women coming up the ranks with a male-dominated field. A lot of snide comments about how you're just going to get pregnant and work part-time. A lot of snide comments about how women can't handle the big tough cases and we only do easy things.
What did he say?
Which is just nonsense. And so my mentality through it all was just to, put my head down, finger, and be really good at what I did. The reality is, though, you shouldn't have to do that. You should be able to just exist and be treated respectfully. Hopefully, as more female surgeons are going out into the world and we start taking over some of these academic programs, things will change for our young female trainees. Okay, last question. Do you have any advice for women who want to go into plastic surgery? So I think my best advice for anybody going into a field that's dominated by men, where you may not always be welcome, is just don't listen to them. You know yourself better than they know you. Don't listen to the critiques. Don't listen to the nonsense we all hear as women that, if you are blunt to the point and good, that you're a bitch, domineering, and aggressive, because you know you're not. Work hard, get the job done, learn what you need to learn, and do your best to change the system from within. All right, guys, and that's it for today. Thanks for tuning in. If you have any more questions, leave them in the comments below. For those of you that submitted these questions, I so appreciate it, and I look forward to our next video.